Hello everyone, my name is Musab Alagaleel and today I'm going to present cross-cultural adaptation and validation of the Arabic version of the intermittent and constant osteoarthritis pain questionnaire. In a brief, osteoarthritis is characterized as joint pain that interferes with the patient's life. The knee, hip, and hand joints can be affected with this disease, and according to a study was done before, that the knee is the most common joint that could be affected with this disease. Osteoarthritis is the one of the most common forms of the arthritis. This disease can be assessed by several questionnaires, and the most one of the most accurate questionnaire that can evaluate pain severity is the pain and constant osteoarthritis pain questionnaire. This questionnaire was developed in focus group to evaluate the pain severity and its impact on quality of the life. The ICRP was used to evaluate the constant and intermittent pain, and this is the only questionnaire that can evaluate those two types of the pain. It can be also used for the progression to follow the progression of the disease and the treatment responsiveness. This questionnaire was translated into many languages before, such as the French, Portuguese, Persian, and the Turkish languages. Our research objectives were translating and adapting the ISOOP questionnaire into the Arabic language and study the psychometric properties in patients with knee and hip osteoarthritis. To check and to check the validity and reliability of this questionnaire in patients with the knee or hip osteoarthritis. Our study is quantitative observational cross-sectional study. It was conducted at the King Abdulaziz Medical City, specifically at the orthopedic clinic, in the period from March to 2018 until the August 2018. We included all the male or female between the age of 18 or until 80 who were diagnosed with the osteoarthritis based on the radiographic criteria of American College of Rheumatology, who has grade 2 or above according to Lawrence classification system, as well as the participant who can speak, read, and write the Arabic language. Other than those people were excluded from our study. Our sample size was based on previous Greek study that that study was found out that 89 participants were enough to do validation and reliability of the intermittent constant osteoarthritis questionnaire. We did a pilot study on 30 participants. Those 30 participants answered the questionnaire in 2 minutes on average, and most of them reported that all questions and answers were comprehensible. Those 30 participants or subjects were excluded from our study. Our study was conducted in two stages. The first stage is the forward-backward translation and then the data collection. We started our study by translating the questionnaire into Arabic language by two independent translators. One of them was orthopedic resident and the other was English teacher. After getting the new Arabic version, getting the two new Arabic version, we compared between these two versions and we took the most accurate version of the translated questionnaire. Then we gave it to uh, other two translators, to translate it back into English language. Then we compared the backward translated questionnaire with the original questionnaire. Then we started the data collection by giving the questionnaire with the consent form to the participants, and then after 2 weeks, we took 29 from those participants and we gave them the intermittent constant osteoarthritis pain questionnaire again with we gave it again that questionnaire again to those patients for the sake of reliability, as well as we added the knee injury and osteoarthritis outcome score for constructive validity. Our data were entered to Microsoft Excel, then analyzed by SPSS. Cronbach alpha was used to assess the internal consistency of the intermittent and constant osteoarthritis pain. The test reliability was calculated using the interclass correlation coefficient. Our study was approved by the IRB IRV review board at the King Abdulaziz Medical City, and our total subjects were 90, and 29 of those 90 were re-evaluated for the reliability testing. This table showing the demographic data. 48.9 participants were male, and the 51.1 were female, and the and here the interclass correlation coefficient was used to assess the retest reliability, and it's the ICC of the total score of the knee intermittent constant osteoarthritis pain questionnaire was 0.84. Uh, and this is the ICC for the total knee, and the score was until the 0.91. Then for the intermittent knee pain subscale was 0.94 until the 96, then followed by the constant pain, which is 0.92. Moreover, the ICC for the total score of the hip osteoarthritis, constant osteoarthritis pain was 0.92, and the score was 0.95 for the intermittent hip pain subscale, and 0.98 for the constant pain, and as well as the Cronbach alpha was 0.88 and 0.93 and 0.94 for the total score, the intermittent knee pain and the constant pain respectively. In addition to that, Cronbach alpha for the hip osteoarthritis was 0.977, uh, point, uh, 0.977 for the total score, 0.96 for the intermittent pain, and 0.98 for the constant pain. And we can see here that the correlation between the intermittent constant osteoarthritis and the KOS showed that the R is 0.235, and the p-value was 0.22, which is showing that it's less than the p-value less than 0.05. Then based on that we have a correlation between the ICOP and KOS. And in conclusion, the psychometric evidence supports that Arabic version of the ISOP as reliable and valid cross-sectional measure of the impact of intermittent and constant pain on patients diagnosed with knee or hip osteoarthritis. In acknowledgement, we would like to thank all participants in our study, as well as we would like to thank Dr. Amr Sultan for helping us in the translation of the questionnaire. For any questions, please send it to my email. Here are my references, and here are the authors. Um, I'm Musab Al and here are the co-authors that help who participated with the this study. Thank you so much for listening.